All right. Hi, guys. I was talking to one of my students on the phone today, and he said, "Man, your throat, you're all choked up so bad." I said, "Yeah, in Texas, everybody I know, especially anybody that deals with allergies at all, it has been horrific. So bear with me. Yeah, I'm all choked up and scratched up and strange. All right, welcome back. Let's open in prayer and we will start. Father, we thank you for this time together. Pray that you would sharpen our ears and our hearts and our mind as we learn together and look at this material. In Jesus' name we pray. Amen. And Lord, I pray you would bless our students. Hope you guys are doing good. We are looking at chapters 33 through 35. We're going to start with a broad sweep of the paintbrush over just mental disorders in general. And then we're going to go into addictions. The last two chapters are addictions. So this is a theme. No definition, right? You're like, dude, what is up with your field? There's no solid definitions, perfect, exact. It's like, yeah, and it's funny. That's part of why I love it, because it's not 2 plus 2 equals 4. But generally speaking, we're looking for people who are showing signs of severe distress. We're looking for deviance. Now, deviance is, I don't mean like a little kid stole a cookie. I'm talking about deviant behavior that deviates from what would be societally and oftentimes legally acceptable behavior. Different types of disabilities could fall into the category of mental disorders as well. And dysfunction, people used to, it was almost like a badge of honor, like bragging rights. Oh, I have a dysfunctional family. It's like, yeah, that's not really something you'll want. And one of the areas that we look at as counselors when we're talking about whether someone actually has a mental disorder is, does it impact the person's ability to function in any area? So the biggie as far as area, well, what do you mean in any area? Well, categorically speaking, we have our family and social life. We have our thought, behavioral, interpersonal life, intrapersonal, sorry, internal world. And then we have school or work. So are you able to function with your family? Are you able to function with your friends? Are you able to function at work or school? And that's kind of how that's broken down into those three primary areas. Almost anything else you could come up with falls into one of those categories. We also look at levels of severity. So someone may be, I don't know. I know some people, everybody experiences some level of sadness, depression, blah, the blues, whatever you want to call it. Everybody has times of anxiety. And you can be pretty doggone depressed and like, man, I am just, all day just dragging and not qualify for a diagnosis. When it goes on for days and days and days, and you begin to like not want to go to work or school or not go to school or work, you're not communicating with your spouse or your children or your family or friends, that's when it's okay. Now it's affecting your ability to actually function in life. We look at undergraduate college kids sometimes, and it's like, okay, they stop coming out of the dorm room. Sometimes their roommate will like go talk to somebody and say, hey, I think something's wrong. It's like, yeah, think. And my roommate has not come out of the room for days. Like, yeah, that's a problem. So they're not functioning. They're not going to class. They're just not functioning. We look at unusual emotions. You may have experienced someone laugh when talking about being sexually abused. That's not normal. Certainly, it's nervousness, and it's kind of okay. Um, sometimes this has the feel of almost evil. It's so weird, like someone's talking about somebody being brutally murdered, and the person just kind of smiles and goes, "Yeah," and you're like, wrong response. So any kind of a emotional response to something that's like sensation, having literally just to do with the five senses, being off. In other words, that has to do with hallucinations largely, and perceptions. And this can be really subtle. So, and when I say perceptions, I'm talking about like, okay, they still saw somebody with a frown on their face and they're like, oh, they're mad at me. Or someone just asked them, okay, so what do you mean by that? And they're like, oh, they're interrogating me. It's like, no, they just wanted to know what you meant. So perceptions being off, all the way to the trees outside are alive and I saw them grab a person, right? So that's a perception. Um, not just fine line between perceptions and hallucinations. And then thinking and behavior, thoughts can run amok and be extremely and severely out of control inside of people's heads, and to the point that it's hard to keep it together externally, and eventually that will flow over into behaviors. Um, Inappropriate behaviors, bizarre behaviors, unusual amounts of like overly laughing and excited and hyper, or rageful, strange behaviors, strange movements, just doing odd things at the wrong times. Those are the kinds of things that begin to cue us in that something's wrong with somebody, and possibly they have a mental disorder. What does the Bible say about mental disorders? Not much, nothing. So as far as the terminology we're talking about. Um, Paul talks about the depraved mind, talks about sin in Galatians and the effects of sin. Sin does lead to brokenness and helplessness. The human condition of suffering, the Bible talks a lot about. I think of the times that Jesus looks at the masses and just has compassion because of their level of distraughtness and um, um, suffering. So there's certainly an attitude in the Bible about compassion for people who are hurting emotionally. King David, man, when you read some of the Psalms, some of the laments that he put out, my soul languishes within me to the point of death. Lord, why have you turned your back on me? How long will you hide your face from me? I have sorrow in my soul day in and day out. I lay down, I cry myself to sleep. I mean, it's on and on and on. It's like, wow. You look at Job, and not that we could trace him um, um, displaying symptoms of a mental disorder, but we have this massive human condition of suffering and loss that he experienced. And oftentimes out of that, there comes all kinds of mental disorders. um, the Bible talks a lot about emotions, balance and control of our emotions, challenges and problems in that area. Idolatry in the Bible days, they were oftentimes had some kind of a physical god they bowed to, or went to the temple of Baal. Here today, we talk about things like materialism, lust, power, control. People, yes, we can idolize people. People idolize their children, their spouse, their friends. Famous people become idolized. Causes of mental disorders, again, no one cause, multiple things influence mental disorders. But there are some things that we know are pretty strong contributors to mental disorders, things like stress. Stress is one of those things that's just common to everything. Any kind of illness, any kind of ailment, any kind of anything. If there's stress involved, it's going to be worse, it's going to be more severe, it's going to be more problematic. Um, Circumstances, there's things that happen to people that we have absolutely no control of, just things just happen. I heard in the news just the other day about a 2-year-old boy who was taken from his parents on the beach by a crocodile. Like they attempted to get the child out of the crocodile's mouth, and was unsuccessful. That happened in Orlando at Disney World. Uh, some of you probably heard about that. That is a circumstance that is extremely difficult for a family to live with long term. And they did find the little boy's body later, and he was dead. So there's all kinds of things that can happen: job losses, changes, divorce, deaths, births. Even positive things can be cause challenges for people as well. Um, we look at biological causes. There's things that go wrong with our bodies biologically. There are predispositions that we have. Some people have kind of a predisposition to depression or anxiety, and literally you can trace some differences in people's brains in terms of the way their brains function. There's hot spots and cold spots in the brains, high activity, low activity spots in the brains, and the brain that can be looked at and observed, and so that those are factors that play into it. Psychological, just our psychological makeup, our thoughts, our feelings is a big part of what we look at, and our social environment obviously has a lot to do with it, positive or negative. And then certainly the spiritual is an important part. And again, if you look really closely, here we are again, spirit, soul, and body. Yes, I'm the spirit, soul, and body guy. And then there's certainly the role of sin, and that is not to be taken lightly, and it's always something to be evaluated and talked about, because it produces guilt and shame and other odd behaviors, and it can even get into addictive kinds of things. There's all kinds of stuff that go along with that. All right. All right, so we're going to go over some, just some of broad, kind of categorically, some of the major mental disorders. This is not an all-inclusive list. This comes from the DSM-5, the textbook. Talks about the DSM-4. There's the DSM-4, then the DSM-4-TR, then the DSM-5. That's Diagnostics and Statistical Manual. Hold on. Diagnostic and Statistical Manual of Mental Disorders. That is the stuff right there. Yeah, that's what that looks like. That is significant because it is all of the codes for all of the disorders and all of the symptoms list for all of the disorders, which is based on millions of hours of research. People ask me all the time, well, how can you tell, the doctor, the psychiatrist sees me for 3 minutes, and how can he tell that I'm depressed? Well, it's easy. Sometimes you can glance at someone and tell they're depressed. You're literally looking at a list of symptoms, and once you hit 4, 5, 6 out of the 9 symptoms, you have major depression. Then you go into how severe is it, and are there other disorders going on at the same time? So we start with the category that of disorders that usually start in infancy, childhood, and adolescence. These are intellectual disabilities. We used to call this mental retardation. There are learning disabilities. There's all kinds of learning disabilities, perceptual, reading, dyslexia, those kinds of things are in there. Motor skills disorders, children who just do not seem to have the ability to develop, to function in terms of manipulating objects and simple tasks like other children do. If you've had children, you go to the doctor for your well baby checkup. At some point, they will give your baby 3 blocks and say, okay, stack these 3 blocks on top of each other. And I'm standing there praying, oh Lord, please help my little kid to feel like stacking the 3 blocks on top of each other, because if they don't feel like it, they're not going to do it. so then they fail the test. They understand that there's that element. But that's what we're talking about in terms of literally just motor skills, just ability to crawl, to walk, to manipulate objects as a young child. Communication disorders, this can be in the form of all kinds of speech impediments or lisps or those kinds of things. Sometimes it's even an ability to process information into a sentence coherently, those kinds of things. Pervasive developmental disorders are things like autism and Asperger's disorder. There's others in there. ADD, you guys have all heard of that. 2 branches of ADD. One is hyperactive and one is not hyperactive. It's inattentive, just difficult paying attention. Feeding and eating disorders. This can be things like failure to thrive. There's one called pica, where kids just eat stuff like dirt and paint. Just crazy. They just like ravenous. They just like, you can't hardly stop them. It's crazy. And then tic disorders, this is the Tourette's type deal, the barking out a cuss word or yelling out a phrase and jerking, weird kind of jerks where they don't have control over it. My put your sense of humor hat on. If you don't have a very good sense of humor, beef it up a little bit for this moment. My youngest girl is gets real goofy and hyper, and she'll like just kind of spaz. And my the other three older ones will look at her and say Tourette's. So it's just I know it's terrible, but it's cute, and she laughs, and it's all in good fun. Anyway, so that's tic disorders. Elimination disorders, enuresis and encopresis, that is holding your urine long periods of time. Encopresis is holding your feces. Kids will not have a bowel movement for a week and a half, 2 weeks. If you're saying, oh yeah, a week, I just have a bowel movement once a week, something is wrong with you. You need to, not mentally, you need to eat more bran. We should eliminate a lot more than that. Um, sorry, I tickle myself. I hope y'all are at least halfway amused occasionally. Um, okay, delirium, dementia, amnesic disorders is a whole nother category. Delirium is when we talk about somebody being delirious, like they've had an automobile accident, and oh, they're delirious, or their fever oftentimes will produce that. Um, that's just incoherent thoughts. They may just kind of be rambling, mumbling stuff. They're restless. They may have some delusions. Dementia, we all know what that is. Alzheimer's and dementia, and then amnesic disorders. There are some really interesting amnesic disorders. I'm not going to go into a whole lot of detail, but there's like this, and I don't remember the name of it, and I'm sorry, but like your inability to recognize someone's face. So it could be you could meet them and turn right around and meet them again, and they don't recognize you. So there's past memory loss, distant past memory loss, recent past memory loss. Inability to create new memories, all kinds of different amnesic disorders. Let's see. I want to make sure I didn't jump 2 pages. Substance abuse disorders, and our next 2 chapters are on substance abuse, so we're not going to talk about this a whole lot, but here's a pretty good little list of some of the drugs that we're talking about, and we'll get into some of the categories in a little bit down the road. Schizophrenia and other psychotic disorders. Schizophrenia is a little more complex than just having hallucinations. There is an overall inability to function, inability to keep down a job. They don't read social cues appropriately. They are inappropriate socially. They say socially inappropriate things. They make body movements that are strange sometimes. Very difficult for someone with schizophrenia to ever have a normal life, hold down a job. It's a really sad situation. Other mood disorders, probably the two most common are depression and anxiety. And you have these categories. I want you to understand bipolar disorder real quickly. Think of a polarization. So you have on one end of the pole here, and on the other end of the pole over here being low, depressed, very depressed, and over here being very hyper and very high. That can be positive or negative, in other words, rage or excitement. People, they're going to buy new cars, and they're going to start a business, and they'll stay up for 5 days straight, all night, and clean the house and do all kind of stuff. And oftentimes they'll have they'll act out sexually, they'll business deals, they'll spend money they don't have. It's just crazy the things that people will do, almost to the point of psychotic. Anxiety disorders, 5 major categories here. This is not all inclusive. These are the 5 I decided to put up there. Panic attacks, that's with and without agoraphobia. Agoraphobia being the fear of going out into public places. It's Greek for meaning open marketplace. So literally they don't want to go to Walmart, to the grocery store, or to shopping at the mall, or go get gas, anything. And some of that is because they're afraid they're going to have a panic attack while they're out. Panic attacks are very debilitating. The person oftentimes feels like they're having a heart attack, feels like they're dying. They sometimes will be in a puddle of tears on the floor for a few minutes, literally. If they do pass out, that's usually okay because then they relax and they'll sometimes hyperventilate and stop breathing and pass out because the anxiety is that great. When they do, their body. The problem is if fall and hit their head, but if they're low enough to the ground or if there's someone there with them to catch them, then that's good. That works out okay. Phobias are interesting. You should Google. There's all kinds of interesting phobias. There's like 264 or something like that phobias. PTSD, post-traumatic stress disorder. You guys have heard a lot about that because of the military. Guys coming back from the military with PTSD. OCD, obsessive compulsive disorder. Obsessions, having thoughts in your mind you can't get out. They're also viewed as intrusive. Sometimes those thoughts are grotesque and horrific. Um, and people really freak out over that because they're like, oh my gosh, I have all these sick thoughts in my head. Yeah, but are they repulsive to you? Yes. Okay, then you're good. They're thinking, I'm a psychopath. I'm seeing blood splattered on the wall and I can't get it out of my head. Okay, that is disturbing. But if you're seeing blood splattered on the wall or seeing dead people and you're enjoying it and you're entertaining it, then that's a whole different problem. And then the compulsions are things that we do. Some of the most common are hand washing, checking. People will drive home and then they'll drive back over the route that they just drove and think, oh, did I run over somebody? They'll lock the door, go get in bed, get out, go downstairs and check all the doors and windows and get back in bed and go back downstairs. And they may do this for 2 hours before they're convinced that they've locked the doors. The counting, they'll oftentimes count. If you know the number of tiles in the room at your office, you might be a candidate. It doesn't mean you have it, but sorry, my sick sense of humor. Um, and then generalized anxiety disorder is literally just general anxiety. They're just like anxious. People are just anxious about almost everything all the time. It can be kind of a low level, but it definitely gets old. Somatoform, soma is of the body. That is Greek. So somatoform disorders, pain disorders, hypochondriasis, factitious disorder, physical or psychological disorders, fiend, and sometimes a mother will fiend their child's sickness and sometimes will even make them sick. I know it's really sick, right? But sorry, there's a lot of sicks in there. Dissociative disorder used to be multiple personality disorders. There's all kinds of levels of intensity of dissociations. Most everybody has experienced a dissociation. If you've ever been sick, not feeling good, maybe on cold medicine, and you're in a room talking with people, and you're kind of like, okay, I hear everybody, and I can respond to everybody, but I'm not here like I'm usually here. I'm like, there's a film between me and you. That is a dissociation, and most people experience that several times in their life. But these people dissociate to the degree that they're not potentially in the severe that they're not aware at all that they're gone. They're like gone. They're like another person. Sexual and gender disorders, sexual desire disorders, desiring. Well, that gets into paraphilias. We'll get to that. Arousal disorders, sexual dysfunctioning disorders, paraphilias. Exhibitionism, exposing one's genitals to people, and usually they turn and go and masturbate. That gets them sexually excited. That's how they get aroused. Pedophilia, sex with children, male or female, masochism and sadism. So sadomasochism is really, 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 really twisted and really sad and really sick. This is people kill people doing this kind of stuff. People die accidentally doing this kind of stuff. It's posed in our society, and you will minister to people who are like, "Oh yeah, fun, yeah, S&M's cool." Guys, it is a very dark, very, very, very dark, very sick, very twisted. And I say this to you not because you need to know it, but to remind you to remind people, because people don't know that. We just had the movie 50 Shades of Grey. Very disturbing. Very, 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 very disturbing. People go and watch it and they just become desensitized. They're like, oh yeah, it's kind of cool, nothing wrong with that, whatever. I'm like, dude, this is in order to become aroused sexually, you have to hurt somebody and or be hurt, um, which is just really, really crazy. Fetishism, being sexually aroused by inanimate or in yeah objects instead of people. Uh, this is usually things like panties or shoes, and then voyeurism is watching people disrobe or be engaged in sexual activities. And then there's the whole gender identity disorders, and boy, isn't that right now in our society with all of the whole today I feel like a woman, tomorrow I feel like a man, kind of stuff going on. There is actual a category of gender identity disorders. Um, Eating disorders, the two biggies here are anorexia nervosa and bulimia. I'm sure all of you have heard of them and are familiar with them. Anorexia can lead to death, can end up in the hospital with a feeding tube. Very difficult to treat. Usually is a residential setting for as long as 18 months, 6 months, maybe a year usually. 18 months is kind of the standard, actually, 1 year to 18 months. And then bulimia. People with bulimia are usually a little bit overweight. They are binging and purging, so they're eating massive amounts of food and then throwing up. The acids burn their throat, tear up their teeth. They don't get the nourishment that they need, so they're malnourished. And yet, sometimes, very often, they're actually overweight. Um, Sleep disorders. The most common one is insomnia. Insomnia comes in many different forms, takes a long time to fall asleep quickly and wake up multiple times through the night, fall asleep quickly and sleep a couple hours and wake up and not be able to sleep at all. There's also sleeping too much, too long. There's all kinds of things. Oftentimes something else is going on when there's a sleep disorder, depression, or anxiety. Impulse control disorders. This is kleptomania, can't help themselves from stealing, pathological gambling, and pyromania. These are fire starters. Personality disorders. There's a long list of personality disorders. I put a few out of here. Borderline personality disorder. Really interesting as a counselor to work with. They will make you crazy if you don't watch it. You're on the pedestal one day and you're in the hole the next. They're very gamey, emotionally gamey, very manipulative. Oftentimes, they will self-harm in some way. That doesn't mean if someone is self-harming, they have borderline personality disorder. Don't become little diagnosticians and get that wrong. But oftentimes, it is. Those two do go hand in hand. There's paranoid personality disorders, antisocial personality disorders. These are kind of psychopath, can be pretty severe, bad. Can just be, I don't really like people and don't really like to hang out with people very much. Histrionic is an interesting one. Histrionic is almost always females, but it doesn't have to be. And these are people who relate sexually. These are the 50-year-old women that are dressing like they're 16 years old and approaching guys in very flirtatious ways. They tend to think that you're their best friend just almost immediately if they like you, and they will get you in bed if they at all can. I mean, it's a kind of a twisted deal. Narcissistic personality disorder. You should Google that one and read those. Histrionic's fun too. It's very interesting stuff. It's just very all about me in very severe ways. People are really difficult to work with or work for. They're smarter than their boss. They're smarter than the owner of the company. They know everything. It's just craziness. And then there's many times in all of the mental disorders, there'll be an other category, not otherwise specified in OS, we call that, where it really doesn't fit. It may be generally speaking in a particular broad heading, but it really doesn't fit a specific diagnosis. So it kind of gives you, it's kind of a little, gives you the freedom to put a diagnosis on there, even when they don't perfectly fit any of the criteria for any of the diagnosis, and it's fairly rare. Most times people fit the criteria if they're in treatment and need it. Suicide, do's and don'ts. There are, well, let me start with the don'ts. Well, do believe them. I'm gonna flip flop. How about that? How about I just flip flop back and forth between do's and don'ts? Always believe them. Never just, oh, they're just trying to get attention. Well, maybe they are trying to get attention, and maybe they've had multiple attempts. The more attempts they have, the more likely they are to be successful. So they attempted 5 times. They are very lethal right now. And at some level, there's a tendency to up the ante. They will increase the intensity of the attempt. The teenage girl, I'm going to die. I took 5 Motrin. Yeah, you're probably not going to die, but why are you trying to hurt yourself? Let's talk about that. Um, don't blow them off. Don't ignore them. Don't make fun of them. Don't say things like, "Oh, you know what? We're sick of hearing it. Just go kill yourself." Because at some point they're gonna be like, "You know what? I'll show them. I just will." And then they go and do, and you don't want that to be on your head. You're looking for intent when someone tells you they're suicidal. Do you intend to kill yourself? Are they capable? Well, I'm gonna get a gun and blow my head off. And he's 10 years old. Do you have a gun? Nope. Does your dad have a gun? Nope. Is there any guns in your house? Nope. Do you know anybody with a gun? Nope. Probably you're not going to get a gun and blow your head off. So that's what we mean in terms of, are they actually capable of carrying out the plan? Is there a plan? Is that plan reasonable? Lethality of the plan. I'm going to take 5 Motrin. I'm going to take a .45 caliber, stick it in my mouth, and pull the trigger. That's what we're talking about in terms of lethality level. How lethal is it? Immediate threat, and I'm kind of going to come back to that, and then level of intensity of their desire to die, the intensity of their plan, picking up on emotional intensity in them. I had someone call me, and a client call me and say, I'm done. What do you mean you're done? Like, done with counseling? No, I'm done with life. I'm like, okay, talk to me, what's up? I'm gonna kill myself. Okay, well, how are you gonna kill yourself? With my .45. Well, her and her husband to shoot for fun and go to gun ranges and shoot, and both own a .45 caliber revolver. And I knew that because she had shared that with me, and as just part of that's one of their hobbies. Kind of no big deal, right? And so I said, okay, so where's your gun? She said, in my lap. I said, is it loaded? She said, yep. I said, is the hammer back? She said, nope. I said, okay. So I'm thinking, okay, I don't have much, but I have a little bit. In other words, it's pointed at my head and the hammer is back. I am like, oh Lord, help us all. We're like, I'm fixing to hear a gunshot and it's over. I mean, that's what I'd be thinking. Um, I was able to talk her out of that, and she's good and was okay. This was a long time ago. I don't know if she's still good, but she got through that, and she continued it in counseling with me. But that's just an example of, okay, I'm going to kill myself. Okay, you really want to kill yourself? Yeah. What's the plan? I'm going to kill myself with my .45. Okay, capability. Is it there? Yes. You have a plan? Yes. Okay, you have the gun. You have it in hand. Lethality, high lethality, immediate threat. Yes. All she got to do is pull the hammer back and pull the trigger. It is at least in her lap and not on her head, and the hammer pulled back. That would have been a higher level of immediate threat and a higher level of lethality. And a higher level of intensity. So I use that to illustrate what I'm talking about when I go through those points. And that is not necessarily, that's really trained professional counselor kind of things to do, but you can you can keep those things in mind as you're talking to them and get a sense for, oh my, like I need to dial 911 and not let them leave my office, kind of thing. And yes, I've done that before as well. I could sit here and tell you stories all night about someone trying to kill themselves, but I won't do that to you. All right, next chapter is alcohol-related problems. Okay, so some broad categories when we're talking about alcohol is, these are just really technical terms. So intoxication, where one has drank enough alcohol to be intoxicated. To to change their reflexes, to change, oftentimes their speech is slurred, those kinds of things. Um, it's it's uh, it's a word that tends to mean you're pretty far down the road of street language would be drunk. Alcohol dependence, and that has to do with isolated events, right? So someone is not intoxicated 24/7. They're intoxicated when they drink enough to become intoxicated. Dependence, you're dependent. Once you become dependent, you're dependent 24/7. And here's what that means. We're talking about a physical dependence. We're not talking about a psychological dependence, although there can be that too, but that's a different category. What this means is that if a person stops drinking, they will have symptoms and all the way to death. In fact, detoxing from alcohol on your own is one of the most high mortality rate detoxes out there. You've heard of the shakes, delirium, tremors, the shakes, sweating, vomiting, throwing up. Well, sorry, that's the same thing. Uh, Headache, body aches, skin hurts to the touch, heart rate increases greatly, blood pressure increases greatly. In fact, that's oftentimes what happens is someone has a heart attack. It's like the heart just blows up. They just can't handle it. Or blood pressure gets so high that it kills them. So that's dependence. They are literally physically dependent. They have to have a drink in order to uh, walk around, in order to stay normal. I know that sounds real twisted, but work with me. In other words, if the person stops drinking, they're going to be doubled over, and passed out, and shaking and throwing up, and a mess. Alcohol abuse. One of the examples, most common examples of alcohol abuse, is that um, they are drinking way too much, becoming intoxicated frequently, but they're not drinking every day. So to become dependent, you've got to drink every day, usually for a relatively long period of time and a relatively large amount of alcohol. We have what's called tolerance. Our tolerance gets built up. So here's my tolerance example. Most of you, um, unless you drink a lot, if you were to drink a six pack of beer right now, especially on an empty stomach, you would be intoxicated. You would be drunk. You would be messed up. You'd be stumbling around and laughing and or get angry or whatever you do when you get drunk. And that's different for different people. If you did that every day for a few months, you'd get to where it did not seem to affect you. That's one of the dangers is people are like, oh, I'm fine, I can handle it, and I can drive, but they really can't because they're still impaired. They just don't realize it. Um, so abuse, another type of alcoholism that falls under abuse is binge drinking. It's a person that'll go away on a weekend and drink just crazy amounts and massive amounts, oftentimes disappear from their families and then quit. And that's just, but they're still not dependent technically because they don't drink all week. And then there's all kinds of disorders that are induced by substance abuse, and we're going to talk about that in more detail later. But bottom line is the alcohol affects the brain and the body so much, and over a long period of time and heavy enough use that there are other disorders that pop up. Let's see. Alcoholism common to all ages, all socioeconomic groups, and all ethnic groups. Is it a physical illness, a sickness, or is it sin? Or is it a little bit of both? Dr. Collins and I both agree that it's probably a little bit of both. Certainly there is a moral choice element to it, but it becomes an illness as well. So it's not just as simple as, well, it's just a sin and you need to repent and quit sinning. It's a little more complicated than that because of the intertwinings of all of the physical things that are going on with someone when they drink a lot. The Bible does not appear to teach abstinence, Dr. Collins says, and I don't see it either. I've heard people attempt to prove that the Bible teaches abstinence, and I've not been able to follow their logic. That doesn't mean I'm encouraging you to go drink. I just don't think we can say that it demands complete abstinence. It teaches moderation. It talks about the dangers of excessive alcohol use very clearly. Urges Christians not to cause others to stumble. That's another um, reason for not drinking as Christians. Causes of alcoholism, obviously, many, many, many different things. And we've talked about this. That again, this is one of those things. There's no one simple answer. There's no one cause. Biological and hereditary influences. It seems that some people, when they drink, something happens in the brain, and it tends to cause them to crave it. You could say, on a layman's point of view, it works for them. It really feels right or feels good for them. And certainly inheritance, certainly that's can be spiritual passed down, but also there can be some predispositions. It seems like biologically. I'm not saying it's 100% biological issue. I'm just saying that's one of many, 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 maybe a very small part of an element for some people, but it is one of the elements. Um, Home environment, family environment, chaos, stress, high conflict, abuse, home and family environments that others in the home are drinking and abusing drugs and alcohol, abusing each other verbally and physically and emotionally, sexually possibly. um, Social cultural influences. Just there's a country song, and I don't like. I like country music, but I hear this and I just turn it. I'm a member of the drinking class. And I'm like, dude, really? I mean, to me, that's just a cultural, like, yeah, I'm a member of the drinking class. Yeah, let's go drinking. I'm like, yeah, no, that is just not helping our society at all. Um, it's just not. So that's what we mean in terms of culture. Also social, everybody I know drinks. What do we do on the weekend? We go drink. Like, okay, not everybody in the world, that's all they do. I'm really sorry, but that's just not reality. um, Go to church and find you a good solid group of people and go to a bowling alley and don't get drunk. What a concept, right? So social input has a lot to do with it, and we have control over that, right? Psychological influences and stress. Some people's personalities, they just tend to. You've heard people say, "I have an addictive personality." Well, I know there's not really technically such thing, but there are personalities that tend to lend themselves more to addictions, certain stressors and inability to deal with stressors, psychologically weak, so to speak. I don't like that term. Hopefully, you know what I mean. Fragile, struggling, doesn't handle change and stress well, those kinds of things. Those people tend to drink. And then certainly spiritual influences, there is a moral element and a choice and a biblical mandate to not be drunk on wine or in anything discouraging from strong drink. So certainly there is a spiritual element to it, and Satan came to steal and to kill and to destroy, and he wants to destroy us all. And what a better way to destroy someone than through getting them lost in alcohol? Um, there are massive amounts of effects of alcohol. Um, Brain function is impaired, balance, motor skill, thinking. If you've ever been around someone drunk, like, yep, I got check, 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 right? You've seen all that, or been drunk yourself. Loss of control of emotion. I remember I had a neighbor, it was in our first year of marriage, and I had a neighbor, and man, when he got drunk, he would get so angry, and he would just, I mean, his wife didn't have to do anything, and he was just cussing and carrying on and all upset. And I was like, dude, you are out of control. Yep, alcohol causes out of controlness of emotion. It can be sobbing. Sometimes people cry. Sometimes people laugh uncontrollably. It can be different things. It depends on the individual. Cirrhosis of the liver, literally just a dying of the liver cells. If you've never seen a liver that's a victim of cirrhosis, you should Google and look up the images. It's just like a little raisin, dried up raisin. I mean, it's just awful looking. It's maybe an exaggeration, but it's bad. And literally, it's just dead. It's gone. And the problem is that oftentimes the person, it's not even, doesn't even begin to hurt until it's too late, and it's not really very treatable. Um, it's like if it's too far down the road, you're just going to die. It's really sad. Permanent brain damage, certainly it kills brain cells, it hurts the brain, damages the brain. Large amounts over a long period of time can cause permanent brain damage. The brain is very resilient, and it can bounce back from a lot, but you can get to a point where it's no longer going to be able to recover. Damage to the central nervous system. It is a depressant, a central nervous system depressant. People are like, well, why do I get all giddy and happy? Your inhibitions are gone. It touches on that, removing inhibitions, and that's the answer to that. But it is a depressant. It makes people sleepy. It makes people tired. It makes people depressed. It massively increases. If someone's struggling with depression, there's a tendency to drink, and it's like, man, I mean, it's throwing gasoline on the fire. If someone struggles with depression and they drink, they're going to be more depressed, guaranteed. Gastrointestinal, all kinds of digestion. I mean, that's just obvious. You're putting all this alcohol in there, and it's your system can't digest the food properly, and it causes all kinds of damage to the gastrointestinal tract, stomach, small intestine, large intestine. It can get polyps, can get ulcers. It can be pretty ugly. Diarrhea, constipation, those kinds of things. Increases the risk of heart attack and stroke, impedes a person's abilities to body to replenish their white and red blood cell production, and obviously that's problematic. Immune system, it messes with the immune system, causes impotence, inability to for males to make someone pregnant, and sexual dysfunction, sexual function disorders. And then there's fetal alcohol syndrome. Hopefully, most people know if you're pregnant, don't drink. But that's a biggie. It's really an ugly deal. Um, Effects, psychological and social effects. Starting out with that, um, we look at the CAGE test. This is a real commonly used test, and it's an acronym because it helps us remember. C for cut down, feeling a need to cut down on drinking. If a person is annoyed by criticism of their drink, man, you drink too much, and they get annoyed, that's a sign. G, guilt for drinking, feeling like, oh man, I feel bad, I drink too much. And E for eye opener, someone who takes a little bit of drink in the morning to help with a hangover, or kind of, man, I gotta level out, I gotta get a little something to kind of ease into the day. Those are the kinds of phrases that people will say, and that's a problem. And then breaking away, that's the end of CAGE. Sorry, I should have done a different break there. Family conflict, alcohol-related problems. It causes family conflict. Obviously, a lot of arguments related to alcoholism and alcoholic behaviors. And then spiritually, literally, it's, the people feel guilty and they begin to pull away from God. They don't pray as much. They don't read the Bible as much. They just begin to pull away. And it gets deeper than that. But to me, that's the core of it. Counseling, old school alcohol counselors used to be very just confrontational and harsh and raw, but criticize, that's supposed to be criticized. Sorry about that. What not to do: criticizing, shame, coaxing. Oh, please don't drink. I mean, none of this works, and it's helpful. The family's real good at doing these kinds of things. It just does not work. You're wasting your energy, and you're just doing more damage, really. Promise me, make them promise me you'll never drink again. Threaten them. If you drink, I'm leaving. Pour out all the alcohol or hide it all. Yeah, that's real helpful. It just makes them mad, and they're just going to go back. That just costs you more money because they're going to go out and buy more. Urge them to have more willpower. That doesn't work. Preach at them, quote Bible scriptures to them. and instill lots of guilt. All these things are things not to do. The 12 steps of AA are phenomenal. The bottom here have 12-step programs. There's also many versions of Christian 12-step programs. Your church may have some, or a church in your area, and they are extremely effective and extremely powerful. Again, if the person wants help and if they're willing, that's a big part of that. Teach coping skills, help them with their social skills. Sometimes if people know how to cope, they won't go, because drinking is a coping skill. If they have healthy coping skills that they can replace their drinking with, then that can be helpful. Help them think about, how do you enhance motivation? Look at talk to them about how it's affecting their relationship with their wife and their children. Those can be very motivating. Things that they want to do in life that they aren't going to be able to do if they continue to drink. Their health, their physical health can be a motivating factor. Um, Work with their environment. Sometimes people need to radically change environments. Yeah, well, I go to the VA and that's all we do is sit around and drink. Well, maybe you need to find another social network and not go to the VA. Relationship-based treatment is important and good and helpful, and encourage social support. um, if you have a chance to meet with family members, you can do some teaching with them in terms of how they can be supportive, but also there is in teaching them to value finding healthy social support. Oftentimes that's done through some sort of a 12-step group. Also medication. Medication first and foremost is detox for detoxification, but there's also medications that can help the brain recover. After someone detoxes, it takes 2 or 3 months for the cravings to go away, and for them to really just kind of be normal again and function normally. And there are medications that help with that. All right, last chapter, chapter 35, addictions. Now, so we did alcohol. Now we're going to move more into other types of addictions. Used to, we thought of the word addictions as only related to drug or alcohol dependence. Now you can be addicted to almost anything. It's actually kind of crazy at times. Like, okay, so I'm addicted to eating. Like, yeah, but that's been a very controversial one. How can you be addicted to something that you have to live, right? So if you can't abstain from it, right? So kind of interesting. But nonetheless, that's kind of the way the word has gone. Can be we've heard of people dying from playing internet games. They just don't get up and don't drink water or eat, and they'll sit there and play games until they die. So that really can be an addiction. TV, shopping, spending, porn, sex, sports, nicotine, chocolate. That's like, yeah, whatever, cute. Some people are proud of their addictions, which is really sad. Caretaking, caregiving, serving, church activities, work. I'm a workaholic. Yeah, you have a good work ethic. No, you're a workaholic. And it's not the same thing. It's not healthy and it's not good. Addiction is a definition of addiction, any thinking or behavior that is habitual, repetitious, and very difficult, if not impossible, to control, regardless of the consequences. So this is the guy who continues to drink, even if his wife says she's going to leave him, and even if she does leave him, continues to drink. What does the Bible say about it? Again, nothing specific in terms of the language that we use today, but Paul definitely talks about being mastered. Don't be mastered by anything. So all things are acceptable, but I will not be controlled by anything. Obey the law of the land, right? So most, I mean, we're talking about doing illegal drugs, so and things that are illegal oftentimes when it comes to addiction. So there you go. Sometimes just understanding that it's not going to solve the problem. It's not going to help with tensions or conflict or anything. All things are possible in Christ. Resistance to temptation would certainly fall into that category. The body is a temple of the Holy Spirit. Protect it, keep it pure, take care of it. So I've literally heard this when people are like, "Oh man, dude, I feel closer to God when I'm doing drugs." Like, no, no, you're just high. Sorry, buddy, but no. um, Bible teaches temperance, and which is like balance, temperance, restraint, moderation, self-discipline, and self-control. Do not cause others to stumble. It's another. We talked about that one already. Be not drunk, and be filled with the Spirit. Causes of addictions. Again, there's no one thing. Um, there have been some studies that say that these are major contributing factors. You know, it's amazing how powerful marketing can be, especially to the younger. The tobacco and the alcohol commercials. I always just sit in astonishment and say, "Wow, the alcohol commercials are the best commercials out there most of the time." And it's really just it's sad, but it's effective. Um, we know that children raised in abusive environments are much more likely to become addicted to something. Social peer pressure, we've already talked about that. There's a lot of overlap between this chapter and the previous chapter. In fact, I left a lot out because of that. So if you're looking for and wondering like, oh, you skipped a big section, it's okay, read it, but it's I'm hitting the biggies, the highlights. Churches that fail to reach youth, boy, that's a tough one. You guys that are pastors, man, make that a priority. 90 something percent of youth leave the faith when they go off to college. It's really sad. Physicians need to be aware and talk to people about addiction potential especially when they're prescribing addictive medications. Oftentimes they don't, not always. I'm not trying to I'm not trying to hate on physicians, but that is can be a contributing factor. And troubled families that abuse drugs and alcohol produce children who also abuse drugs and alcohol. These are categories or types. Again, this is not an all-inclusive list, but you have depressants. I talked about alcohol being a depressant. It suppresses the central nervous system, slows things down. Stimulants, these are the guys that are just running around hyper, increases activity in the central nervous system. Opiates, which tend to be used as painkillers, um, produce euphoria and relaxation. These are things like heroin, morphine, and codeine. There is a street value to all of these, to morphine and codeine, by the way. Hallucinogens are exactly what they sound like. They create hallucinations and delusions. They impair memory. They heighten sensory awareness. Adrenaline addiction. People you've heard the term, I'm an adrenaline junkie. They got to jump out of airplanes with parachutes and do jumps on bicycles and ride motorcycles fast and race cars and all that kind of stuff. I've actually have quite a bit of this in me, which is sad, but I've got it under control. I'm okay, but done some crazy things in my life. Um, and then again, medical detox, which we really already talked about, and that's it. Oh my goodness, hallelujah. All right, guys, goodbye, good night, God bless. I will see y'all on the next one. Hope y'all are doing well. Bye-bye.